Hello, my name is Philomina Bigelow, and the topic of my capstone intervention is improving adolescent young adult cancer patient care. A couple of things to cover before I get started here is that there is no globally agreed upon definition of what constitutes the age range of adolescence, young adulthood in oncology. In the United States, it's generally thought to be between the ages of 15 to 39. For the purposes of my intervention, I am defining this age range as between the ages of 18 to 39. Additionally, instead of using the full phrase adolescent young adult, I may use the term AYA. This is a topic that is very important to me because I am an adolescent young adult cancer survivor. In February 2012, I was diagnosed with Hodgkin's lymphoma and underwent several rounds of chemotherapy lasting over several months before I went into remission. When I was undergoing treatment, I had a lot of resource needs, especially for connecting with other adolescent young adult cancer patients, and my needs were not met. Nobody gave me those resources, and I was too sick and too tired to look for them myself. I don't want other AYA patients to go through that, which is why I developed this intervention. The theoretical perspective for this intervention that I utilized was lifespan developmental theory. According to this theory, maturation and change are ongoing throughout one's life. The developmental stage an individual is in shapes how one may experience the stressors of cancer. Cancer affects the progression through a developmental stage. Conversely, the developmental stage an individual is in shapes how one may experience the stressors of cancer. General issues affecting adolescents and young adults, whether or not they have cancer, are this is the time period when individuals are starting to pursue higher education or vocational training, get established in their careers, or try out different careers to find out what they want to do, explore their sexuality, navigate dating relationships, try to get married and have children. According to the research, AYAs often experience poorer treatment outcomes as compared to other age groups. Some of this has to do with some of those very normative developmental issues. AYAs often feel a sense of invincibility, which may delay seeking care and also may impede their treatment compliance for medically prescribed treatments. Additionally, financial barriers for those who are not quite established in their careers and may lack insurance in the United States may be a barrier to initially seeking medical care and also be a barrier to accessing specialized treatment resources. Many AYAs report not getting help with the biopsychosocial stressors affecting them. Oncology professionals have no required training on the AYA patient population and their needs. Aside from financial issues and late effects from treatment, AYA medical providers are often unaware of the biopsychosocial stressors affecting this population. One stakeholder reports, "My disease was treated very well, as were my symptoms medically, but anything else was not talked about, discussed, or even offered help on." So the need statement for my intervention is that oncology care providers need knowledge of the biopsychosocial needs and resources of their adolescent and young adult patients in order to provide care and resources that remove the effects of biopsychosocial stressors. The goal statement for my intervention is that AYA oncology patients will not experience biopsychosocial stressors. My intervention could be completed at any major hospital that has an oncology clinic and an oncology social worker. Basically, this involves the oncology clinic social worker developing a PowerPoint training and presenting it to oncology care providers in the format of a lunch and learn. So once the training was developed, the training would be advertised using flyers and emails, and providers would have the opportunity to sign up. And then they would show up and sign in on an attendance sheet, and they would be provided with a lunch, such as a Subway sandwich and some sort of a beverage like bottled water. This may incentivize providers to take time to attend this training so that while they are increasing their knowledge on an important topic, they're also getting to eat lunch, which sometimes they may be too busy to do due to their busy schedules. During this training, it would take place in the hospital. It's probably in a conference room, and it would be capped at about 20 to 25 providers per training session, just to account for being able to do more small group interactions and more meaningful interactions with the facilitator. PowerPoint training would discover some of the general needs and issues affecting this population. And at the end of the training, providers would be asked to take a post-test assessing their perceived increases in knowledge, and they would be given patient resource sheets and asked to give these to their AYA patients. There are two desired outcomes from this training. One desired outcome is that oncology providers will be educated on AYA biopsychosocial stressors and available resources. There are two indicators that this outcome will be met. The first indicator is that we would achieve a rate of 90% of all current oncology clinic staff attending one training session within 1 year. And that is very easily measured by having providers sign in on an attendance sheet when they arrive. The second indicator for this outcome being met is demonstration of 80% competence on a training post-test. And this would be measured by the previously discussed post-test that providers would take at the end of the training session, where they would answer questions in regard to different topics regarding needs and resources of the AYA population, such as this training enhanced my knowledge in regard to fertility concerns and fertility preservation for my AYA patients. And the answers to this would range from strongly disagree to agree to strongly agree. And the goal would be for 80% of those questions to be answered with agree or strongly agree to show an increase in perceived competence and knowledge from this training. The second outcome from this training would be oncology providers will engage in discussion regarding biopsychosocial stressors and resources with patients, because I don't just want providers to be trained, I want them to use that training with their patients on a regular basis. So there are two indicators that this outcome would be met. The first one is that AYA oncology patients will report engaging in discussion with providers regarding biopsychosocial stressors. The second indicator is that AYA oncology providers will distribute resource sheets to patients. Both of these indicators would be measured by surveying AYA patients of providers that have attended this training. What that would look like is the oncology social worker that facilitated the training would look at the attendance sheet for providers, and after the training was completed, they would look for the patients of these providers as they came in for their scheduled appointments in clinic. And when they arrived, after they saw their provider, they would be asked to answer this survey. And the survey would ask questions such as, did your provider discuss fertility and fertility preservation with you? Yes or no? And a variety of questions like that. Were these issues discussed? Yes or no? And also there would be a question that asked, did your provider give you a resource sheet for AYA cancer patients? Yes or no? And ideally, all of the questions would be answered yes on these surveys to demonstrate that, again, that providers are utilizing the information that was given to them. So I don't expect providers to become experts on the specifics of every single resource. I really more so expect them to know that there are resources available and to help connect with that for their patients, to let them know what's available and to talk about some of the issues affecting them. Also, in regard to these resources, patients don't have to use them if they don't want to, but I just feel that it's important that they know that those resources are available and that they're there so that they can use them as they wish. Thank you very much for your time.